Good afternoon, everybody. Hope you're fine and safe at home. So, today we are going to commence with the post-mortem report writing in case of natural death. Okay, as I already said you, autopsy is to see by oneself. Autopsy is to see by oneself. Post-mortem means after death. Okay, post-mortem examination. I'll give you the definition of post-mortem examination. Post-mortem examination is a scientific examination of dead body. Post-mortem examination is a scientific examination of the dead body carried out under the law of state. Okay, post-mortem examination is a scientific examination of a dead body which is carried out under the law of the state. Its aim is to identify prosecution the guilty and to protect the innocent civilians. Okay, its aim is to identify prosecution the guilty and to protect the innocent civilians. Okay, this is the definition of post-mortem examination. Okay, I'll repeat it once more. Post-mortem examination is a scientific examination of the dead body which is carried out under the law of state. Its aim is to identify prosecution the guilty and to protect the innocent civilians. Okay, here you have to differentiate between what is mode of death, what is manner of death, and what is cause of death. Okay, mode of death, as you already know, is coma, asphyxia, and syncope. Mode of death is coma, asphyxia, and syncope. Okay, coma, asphyxia, and syncope are the modes of death. Okay, the modes of death are never the cause of death. Okay, the modes of death are never the cause of death. Okay, manner of death may be suicidal, homicidal, or accidental. Suicidal, homicidal, or accidental. Okay, and cause of death may be natural or unnatural. Natural or unnatural. I repeat, modes of death. Modes of death are coma, syncope, and asphyxia. Coma, syncope, and asphyxia are the modes of death, and modes of death cannot be a cause of death. You cannot write a mode of death as cause of death. Okay, manner of death is suicide, homicide, and accidents. Manner of death is suicide, homicide, and accidents. Okay, and cause of death is natural or unnatural. Okay, so today we are going to write the post-mortem report in case of unnatural deaths. Okay, in case of natural deaths. Okay, in case of natural death. Shall we begin? As already you know what has to be filled in MLCPM number, whatever the number is there, whatever the number is going on, you have to fill that number. For instance, it is 15, postmortem number 15 of 2020. Like that, likewise, you have to fill it postmortem 15 oblique 2020, or you can fill it as you like, that is 2019, right? Okay, you have to give it a number. Okay, now ADR and crime number, whatever the number which has been provided to you in the inquest, you have to fill up that number. Okay, and from the police station which it belongs. Okay, now as usual you have to write where the autopsy has been performed. Okay, always I say, if you perform the autopsy at Pravra Rural Hospital, you should write it as an Pravra Rural Hospital. Okay, now the name of the disease. Okay, the name of the disease, as already said, you have to take name of the disease as Mr. XYZ. Okay, or Miss XYZ or Mrs. XYZ. Okay, and the village or city to which he or she belong, you have to write it over there. Okay, now the taluka and the district, it is already given in the Panchnama. You have to write it, the taluka and the district, in the Panchnama. Okay, now by whom performed, I already said you, as it is a medical document, you cannot expose the names. Okay, so you have to write by Dr. ABC, by Dr. ABC. The dead person, you have to write Mr. Miss or Mrs. XYZ and performed by Dr. ABC, along with the village he belonged, the taluka and the district. Okay, now we'll commence with the first column, that is general peculiarities. Okay, first, in which the question has been asked to you, that is, by whom was the corpus sent. Okay, now you have to write, if the corpus has been sent by the Loni police station, you have to write the corpus has been sent by Loni police station. Okay, name of the place from which sent. If the patient is brought to Pravra Rural Hospital, you should write it as an Pravra Rural Hospital. Approximately the distance is 0 kilometers. Okay, from our casualty to our mortuary, approximately the distance is 0 kilometer. By whom was the corpus brought? Okay, now as I already said you, in autopsy you don't require the permission of the relatives, because the body is handed over by the police to you, and after performing the post-mortem examination on the body, you hand that body over to the police only. You don't hand that body over to the relatives. Okay, now this is the difference between pathological autopsy and medico legal autopsy. In pathological autopsy you need the permission of the relatives. Okay, in post-mortem examination, according to section 174 of CRPC, you need not to take consent of the relative, because the law is already permitting you. Okay, now in case of post-mortem examination, the body is not handed over by the relatives to you, it is handed over by the police, and you have to perform the autopsy, and thereafter you have to hand it over to the police, and the police then hands over the body to the relative. Okay, now whoever the police has brought, ASI, head constable, or in case of murder there is and PI, you have to write the name of the police who has brought. For instance, you will take police naik, okay, or head constable. Over here we have to write his buckle number and his name, and where, in which police station he has been posted. Okay, now by whom was he identified? Okay, now a brother might be there, or son might be there, or sister might be there. Whoever is identifying the body, you should write his name and obtain a signature. Okay, write his name over there and write the relation with the dead body. Okay, now whenever the post-mortem inquest is completed, the police brings the inquest to the doctor, and doctor signs it over as received, and puts the date as well as the time of receipt of the inquest Panchanama. You have to fill up all these forms over here. Okay, now if it is of today, today is 28/8/2020, it is 12 noon. You have to write it 12 noon. Okay. Now the date and time of commencement of the postmortem autopsy. You have to write the date and the commencement of the postmortem autopsy. In next column, you have to write the date and ending of the postmortem autopsy. Ending of the postmortem autopsy. Okay. Here you have to write the date and the time correctly. Okay. At what time the inquest has been given to you. You have to write that time on the inquest. Okay. And with you, it should be duly signed by you. Okay. And commencement of the autopsy and ending of the autopsy with date and time should be notified in this column number A and B of 4. Okay. A and B of 4. Okay. Now, fifth, subject of accompanying report from the police officer or magistrate together with the death if known. Suppose case, death or reason of examination. Okay. Now you can write as per fact mentioned in the police inquest, the disease was brought in dead at Praura Rural Hospital, Loni, and on so and so date and so time. Okay. You have to write the date and time. Okay. With alleged history of heart attack. Okay. Which alleged history of heart attack. Okay. Now as an medico, you should not use the word as an heart attack, but it is supplied to you by the police, and the facts are written in the inquest panchanama that हृदय विकाराच्या झटक्याने मृत्यू झाला. So you have to write history of heart attack over there. Okay. Now it is an supposed cause, it is not an final cause, so you have to write it is an supposed cause. Okay. The body was sent for medico legal postmortem examination to know the exact cause of death. Okay. Now here the supposed cause, not necessary the supposed cause may be the final cause of death, because autopsy, I already said you, autopsy is to see by oneself whatever you see in the postmortem examination, what are the abnormalities or what are the injuries or the body, you have to write it in your postmortem examination. Okay. Now column number 6, as I already said you, if you are performing the autopsy in the autopsy room, you need not to fill up this thing. Okay. This thing to be filled up when you are doing the spot examination, spot postmortem examination. Okay. So here if you are performing the autopsy in the autopsy room of Praura Rural Hospital, you have to write over here not applicable, because you are performing the autopsy in the autopsy room. Okay. Now second, that is external examination. Okay. External examination, in which there is column number 7, that is sex, apparent age, race and caste, description of clothes and ornaments on the body. Okay. Now here you have to write whatever the person is wearing, whatever the clothes are there on the dead body. Okay. You have to write each and everything. Okay. Now if he is a male, he is wearing kurta, dhoti, shirt, pant, banyan, underpant, whatever the color of banyan underpant or the clothes he is wearing, or the pants whatever he is wearing, you have to write the color of the pant. If there is any thread on the wrist, or if there is thread at the present in the neck, or if there is thread present around the waist, you have to write it. In Indian scenario, it is very common to find all these things, so you have to be very particularly in writing all these things. Okay. For instance, now we will take as an age as 60 years male. Okay. So now you have to write 60 years, approximately 60 years of male. Okay, the body, if there are clothes on the body, you should write the clothes, or if the body is in naked condition, you have to write it as an body is in naked condition. Okay, now if the body is not stained with blood, mud, okay, or any vomiters, you have to write it as not applicable, or if it is stained, you have to write it is stained with blood or mud particles. Okay, now in column number 9, if there are special marks on the skin, such as scar, tattooing, any malformation, peculiarities, or other mark of identification, state of teeth in newly born infant, the length and if possible the weight of the body to be recorded together with the state of hair, nails and umbilical cord, its length, whether placenta is attached or not, if present, its size and condition. Okay, now here we are performing the autopsy on a 60 years old male. Okay, now here is not an infant. Okay, so infant or fetus, so you don't have to write all the peculiarities, but if it is an infant or it is an fetus, you have to write all the peculiarities. If it is a fetus, whether umbilical cord is there, what is the length of the umbilical cord, you have to take the head circumference, you have to take the chest circumference, or you have to take the toe heel length. Okay, and by his rule, you can definitely determine the age of the fetus. Okay, but now here we are doing the autopsy on the 60 years old male. So you can write the body is identified one. As I already said you, who is going to identify the body, you have to write the name of that person over here. So whatever the name, you know the body is an identified one, so you have to write body identified one by police and relatives. Okay, now next, what is the condition of the body, whether well nourished, thin, emaciated, warm or cold. Okay, now here you have to write heavily built and cold, heavily built and cold. Okay, what is the state, next column is what is the state of rigor mortis, whether well marked, slight or absent, whether present in the whole body or parts. You have to write it over whatever the condition of the rigor mortis is there, you have to write. In this case we will take it is well marked. Okay, in this case we will take well marked. Okay, now next column, that is the column number 12, that is extent and sign of decomposition, presence of postmortem lividity on the buttocks, leons, back and thigh or any other part, whether bullae present and the nature of their contained fluid, condition of the cuticles. Okay, now here as the body is not decomposed, so you have to write there is no sign of decomposition. Okay, postmortem lividity present over the backs and the posterior aspect of the thigh is fixed. You have to write all these things. Okay, as I already said you, what is darkening of death, what is postmortem lividity. Okay, it is accumulation of blood in hollow and toneless capillaries of the body. It is accumulation of blood in hollow and toneless capillaries of the body. Features, whatever the features are there, you have to write the features. Okay, if the eyes are closed, you have to write it as eyes are closed. If there is any oozing of material from the mouth, nostrils, you have to write it oozing of material from mouth and nostrils. Okay, now here we can write it as eyes closed, mouth closed. There is no oozing of any material from the mouth, nostrils and ears. Okay, there is no oozing from mouth, nostrils or ears. Okay, now condition of the skin in case of suspected case of drowning. Okay, here we are doing the case of natural death, we are not doing the drowning, so you have to write it as a not applicable one. Okay, in column number 15, the injuries to the external genitalias, indication of purging. If there are any injuries to the external genitalias and there is indication of the purging, you have to write it as if there is any injury, you have to note down that injury. In this case, we will take it as there was no any injury to the external genitalias and there was no any indication of purging. Okay, now in column 16, it has been asked to you what is the position of the limb, especially of arms and fingers, in suspected drowning, soil and the presence or absence of sand or earth within the nail or on the skin of the hands and feet. Here the question has been asked, whatever the condition in which the condition the body is lying on the autopsy table, you have to write it likewise. Okay, so here in this case we'll write it as straight and supine, straight and supine. Okay, if there are no any injuries found over the body, okay, in column number 17 you have to write it as no evidence of any injury. Okay, as it is a natural death, so there will be no any kind of injury. And already said you in column number 9, in column number 5, that the patient was brought in dead. The patient was brought in dead. Okay, so there were no any injuries over the body. You have to write it as there was no any evidence of injuries. Okay, was there any fracture on palpation? Okay, so in this case you have to write no fractures on palpations. Okay, as there are no any injuries, external injuries to the body, you have to write in column number 18 A that it is not applicable, as there are no fractures and there are no injuries, so you have to write it as not applicable. If there are any injuries in column number 17, you have to write likewise, yes, these injuries are antemortem in nature. If there is injury of the if therapeutic IV mark is there or therapeutic central line mark is there, you have to notify that thing in column number 17. Okay, and you have to write it as an antemortem in nature. Okay, now third part, that is internal examination. Okay, 19, that is head, in which subcolumn injury subcolumn 1, that is injury underneath the scalp, their nature. Okay, if there is any kind of injury underneath the scalp, you have to write it the injury over here, but in this case we will write no injury underneath the scalp. Okay, in column number 19, section 2, that is skull, that is vault and base, describe fractures, their size, dimension, direction. If there are fractures, you have to describe the fractures, but in this case we have not noticed any kind of fractures, so you have to write vault and base intact. You have to write vault and base intact. Okay, now in column number 19, subsection 3, brain, the appearance of its covering, size, weight and general condition of the organ itself, and any abnormalities found in it, examination to be carefully noted with weight. Okay, so here we'll write brain and meninges are intact, brain intact and meninges intact. We'll move up to column number 20, that is thorax wall, thorax. Okay, in which column number 20, that is thorax, in which subsection A, walls, ribs and cartilage. If there are any kind of fractures on the walls, ribs, you have to write it walls and rib fracture. As we said, there are no external injuries as well as internal injuries, so we will write wall and ribs are intact, wall and ribs are intact. So next column, that is column number B in 20, that is pleura, no not containing any fluid. You have to write pleura, not containing any fluid. In column number 20, subsection C, that is larynx, trachea and bronchi. You have to write it over intact and mucosa congested. Intact and mucosa congested. In column number 20, D and E, the condition of the lungs has been asked to you, and if it is edematous, you have to write intact, congested, edematous. Intact, congested and edematous. Okay. Next column, that is pericardium, you can write it as unremarkable. Okay. Now here comes the main column, that is column number 20, G, heart with its weight. Okay, you have to take out the heart, you have to dissect the heart. Okay, now you have to take out the heart, and first you have to weight the heart. Okay, after taking the weight, you have to note the weight on your rough answer book. So here we will take at the weight as 417 grams. Okay, 417 grams. If there are patches present over the heart, you should write white patches over the anterior surface and its size. Okay, here we'll take the size at 3 into 2 centimeters. Okay, now left, you have to write whether there is vicinity, whether there is heart, whether there is what do you say, fat, whether there is fat in the vicinity of heart. You have to also notify that thing. Okay, now we'll take as 417 grams of heart with white patches over the anterior surface of size 3 into 2 centimeters with fat seen around the vicinity of the heart. Okay, with fat seen around the vicinity of heart. And after doing the dissection of the heart, you have to write blocks. Okay, you have to write blocks. So we'll write blocks. If the artery is blocked, you have to write the blocks here. Left circumflex artery hardened with 90% block. You have to write left circumflex artery hardened with 90% block. Left anterior descending artery hardened with 95% block. Left hardened with left anterior descending artery hardened with 95% block. And atherosclerosis changes might be seen, and it might be thickened pipe like, and when you cut that artery, you will find a crackling sound. So that is the conclusion, that the artery is hardened and thickened cord like. When you separate that artery and when you cut that artery, there is an cracking sound over there. So I'll describe it once more. That is 417 grams with whitish patch on the anterior surface of size 3 into 2 centimeters, fat seen around the vicinity of heart, with left circumflex artery hardened with 90% block, and left anterior descending artery hardened with 95% block, and atherosclerotic changes or plaques at places. Okay, now large vessels you should write intact. Additional remarks you should write it as nil. Okay, next important column, that is column number 21, that is of abdomen. Okay, if the walls, peritoneum cavity are intact, in this case we have to write it as an intact one. Okay, the buccal cavity, teeth, tongues and the pharynx, if there are no any abnormalities found over here, you should write it as an unremarkable one. Okay, now in esophagus you have to write intact and congested. What was the condition of the stomach and its content? You have to write contains about 250 to 300 grams of yellowish colored undigested food material with no foul smell. Okay, contains around 250 to 300 grams of yellowish colored undigested food material with no foul smell. And the condition of the mucosa, you should write the condition of the mucosa is congested. Okay, I repeat once more, the content of the stomach, stomach and its content. The contents around 250 grams yellowish color undigested food material with no abnormal smell and mucosa congested. Okay, now here in subsection E and F of 21, it has been asked you small intestine and its content, large intestine and content. You should write partially loaded with gases and feces. Partially loaded with gases and feces. Okay. Now here the condition of the liver has been asked you, large liver with weight and gallbladder. Okay, what will be the weight of the liver? You have to write the weight of the liver. If you find any abnormalities over the stomach, over the liver, if you find any color changes over the liver, you have to write the color changes. Okay, now the liver looks brownish. Okay, but in case of cirrhosis of liver, it becomes yellowish. Okay, and it increases in size. You can find micro and macro nodules present over the liver. This is the signs of liver cirrhosis. Okay, so here you can write it as intact congested, or whatever you can see with your naked eyes at the time of autopsy, you have to write it over here. Okay, now pancreas, you have to write is unremarkable. Okay, spleen and its weight 110 grams and congested. 110 grams and congested. Okay, the commonest cause of splenomegaly in India is malaria. If there is any kind of infection in the body, the spleen is palpable. The spleen is when the spleen is palpable, when the spleen becomes twice its size, then the spleen is palpable. If there is any kind of infection in the body, the size of the spleen increases. Okay, the kidney, you have to write it over as kidney and its weight as intact. If there is any abnormalities or the capsule is not striping off easily, you should write it over there. Okay, the kidney should be always open like a book. Okay, it should be always open like a book, and try to stripe off the capsule. Okay, now if the capsule is easily striping off, you can write it as the capsule is easily striping off, or the capsule is not easily striping off. Condition of the bladder, here the condition of the bladder, whether it is empty or full, you have to write likewise. Okay, after doing autopsy. Organ of generation, if there is any kind of abnormalities in the external genital areas, you have to write it over here. Okay, now here next column, additional remark with where possible, medical officer deduction from the state of content of the stomach as on the time of death and last meal. If you have to write anything over here, time of death, you can write time of death. Whether the state of viscera, you have to preserve the viscera, or not. Here you have to write it viscera not preserved, because here we are concerned with the heart. By naked eye examination, if you are finding the block in left circumflex artery and left anterior descending artery and right coronary artery, then you need not to send it for histopathological examination. But still, if you want to send it, you can send that thing to the histopathological examination in 10% of formalin. Here we are not preserving the viscera because we already know the cause of death, and there is no any kind of foul smell in the stomach, so we are not preserving any kind of viscera, but we are retaining the organ, that is heart. Will send for histopathological examination in 10% of formalin. Okay, next column, if there is any kind of injury over the spinal cord, if there is any kind of injuries over the spinal cord, you have to write the injuries over the spinal cord, or if there is no any kind of injury over the spinal cord, you can directly write it as intact and not examined, okay, or not examined or not opened, okay. Now here, whether the antemortem injuries found on the dead body were sufficient in ordinary course of nature, okay, you have to write it as nil and not applicable in A, B and C column, okay. Opinion as to cause of death, you have to write death due to coronary artery disease and its complication. Death due to coronary artery disease and its complications, okay. Now after doing all these things, you have to duly sign, you have to give the stamp and designation on what post you are working in the department or at PSC level or at civil hospital, whatever with name, you have to sign the duly sign the postmortem report, okay, and then you have to enter the date on which you have performed the autopsy, okay. Next and lastly column, that is date and place, okay, you have to again enter the date and place over here, place where you have performed, and that is Pravara Rural Hospital, okay. Next is forwarding to the police sub inspector Loni for information with reference number, whatever the PM number is there, you have to write the PM number and with date, okay. If the viscera has been preserved, you have to tick mark over there, and then again you have to sign it by the person who has done the postmortem examination. You have to sign it over here with the name and the designation, okay. Now next thing, after doing all generating all these reports, you have to take and received from a police that he has received and copy, he has received the copy of the PM report on this date and this time with his buckle number and the police station to which he belongs, okay. This was all about postmortem report writing in case of natural death. Thank you.